Good evening, everybody. Welcome to Young Black Physician 2023 third talk on reproductive health. You know, this year we've covered a lot of topics from what is reproductive health, what is abortion, what's contraception, to going to talking about when should I freeze my eggs? How do we deal with fertility? Catch all those videos on our channel. Make sure you remember to like, subscribe, and follow us on our social media pages. Tonight, we have a special treat for you. We have two awesome Black women, Black mamas, who are here and are able to share their story on our main topic for tonight, which is everybody's been talking about it throughout the year, the rise in maternal and infant mortality amongst Black women and Black babies. That is our topic for tonight. We want to make sure as young Black physicians, we are sounding the alarm. You know, we are always here for educating you and telling you the truth from an expert opinion, as well as the truth from our own patient perspective, as much as we can. So that's what we're going to do tonight. Stick with us. Before we get started, I just want, as we always do, who are young Black physicians? Essentially, we are a team of young Black physicians from many different specialties. I myself am a gastroenterologist, and we are providing topics in education and discussion and discourse on topics that affect Black and Brown communities, because our mission is to educate, enlighten, and elevate, and to make sure that we are trying to facilitate as much as possible the end to health inequity. So, without further ado, let me do our small disclosures and then we'll do some introductions. And here we go. So, as you know, Young Black Physicians is always not a paid service. We are not receiving any money from any pharmaceutical companies, any third-party companies, biotech companies, or health institutions, or any private or public institutions for today's event. The event has already been pre-recorded and it is for educational purposes. All of the information shared here will solely reflect the reviews of the panelists, and this will include the panelists' research of nationally available information, as well as the panelists' own personal experiences. The views expressed in this video are not representative of our associated institutions. This is not to be taken as strict medical advice. All content, including any text, graphics, images, and information contained on or available through this platform is for general information purposes. As always, please talk to your doctor or qualified healthcare provider for more information about things that we discuss here. All right, now with that said, let's start with our introductions. All right, we have Dr. Guinea Ikwezuma. Go ahead.
So my name is Dr. Guinea Ikwezuma. I am an obstetrician and gynecologist, as well as I'm currently taking advanced training in pelvic surgery. But we are so happy to have our esteemed panelists here to have a topic and discuss this topic that is near and dear to our heart. So without further ado, I'd like to introduce Kelly Moore.
Hi, I'm Kelly. I am currently located in the Metro Detroit area, and I am a proud mom of two.
Hi, I'm Trish, and I am living in Pittsburgh, and I'm a mother of one 15-year-old son.
Great.
I'm glad to have you guys tonight.
Yeah, we're so happy to have you. So we've heard the talk in the media about, like Dr. Allen said about Serena Williams, or some of the other high profile individuals that have had instances where maybe they had adverse events that occurred with maternal health. And I think Dr. Lee had a couple of instances she wanted to share about as well.
Yes, I will. So essentially, we have Dr. Shalon Irving. She herself was a Black female doctor who in 2017 actually lost her life after or due to pregnancy-related complications. As Dr. Ikwezuma had mentioned, we have Serena Williams, as we know, who has had her pulmonary embolism, and for which she tried to explain to the doctors what she was feeling, because she herself actually had this happen to her before, and she knows her body, and had to really fight the medical team in order to get the testing that she needed, which resulted in the appropriate treatment. We also have some of our track Olympians, our own track and field Olympians, Allison Felix, who had complications after her pregnancy. And as we all know, Tory Lane this summer was found dead in her home after being 8 months pregnant. And it was determined that she had pre-eclampsia, and that was the cause of her death. I mean, these things are all preventable. And that's what we're here for. We're talking about issues that affect us and that are causing people to have their lives lost, for which we can prevent from the medical team as well as from informed patients.
And one of the things that we do know is that despite African American women, despite educational upward mobility or socioeconomic status, they are still, African American women are still at a high risk of these complications that occur. Now, there's some of these things that are for sure, like Dr. Allen mentioned, that are preventable. Some of these issues might be multifactorial, and I think we're going to get into and what we mean by multifactorial. There is a little bit more than just meets the eye, which may include social determinants of health, which is something that, you know, a topic we've talked about with Black Doc Talks, and as well as among young Black physicians. And then there are other factors that are still that need to be understood, that may include, for example, training, the cultural experience, and some of that we're going to delve into now. So I think what we need to do at this point, though, is get a more unique perspective from some of our panelists and have a more informed discussion about what their experience was.
Yeah, and actually, before we ask our first questions to the panelists, just to give on a national kind of level, so we know what kind of numbers we're talking about. Dr. Ikwezuma, I think you were going to give statistics on, from 2018 to 2021, how
Right.
there's been this rise. So
Right.
I'll let you go ahead and do that.
So one of the things that as we were talking about, looking at the difference between African American women and, when you take even when you account for socioeconomic status, looking at 2018, and these numbers are provided by the National Health eStats from the National Center for Health Statistics, by an article authored by Donna L. Hoyer, PhD, and you can look this up on the CDC website if you want to further delve into that. But as far as looking at 2018, Black women, the total number of deaths was about 650, and there were 206 of those that were Black women. And now when you look at 2021, again, it was about 650 deaths in 2018, and that number nearly doubled to about 1,200 deaths total for the population. And of all those deaths, Black women made up about 30% of those deaths, with about 362 deaths recorded. And that is a staggering number when you think about the fact that African Americans in total only make up about 12.1% of the US population. So just kind of think about that for a while. The reason we need to address this is to figure out what are the other factors that could be contributing to this. And it really is it is a national issue when we think about it.
Exactly. So with that said, we want to talk to Kelly and we want to talk to Trish, to kind of even share with us their experiences. And first and foremost, I have to say thank you all again tonight for coming on to even share your experience. And the goal of all of this is that we hope that it would offer some healing to some folks who are listening. Both males and females, because we know such a traumatic event affects everyone all of their loved ones, right? As well as we want to be able to hopefully, as you guys tell your story, offer some healing in discussion with us. So we'll get started with our questions. The first and foremost is, you know, we just want to have a little time to share your own personal experience. What happened with your pregnancy, your pre-pregnancy experiences, what happened during your pregnancy, and what happened with your delivery and after delivery experience. And Kelly, if you'd like to go first, that would be fine.
Okay. So my more so traumatic event happened with my second pregnancy. Just to give a little bit of a backstory, when I was 19 years old, I started taking birth control, and I ended up in the hospital for a month with multiple PEs due to taking that medicine. Well, that's what we thought at the time. So I was on medicine.
So pulmonary embolism, just want to add to
Yes.
that.
Oh,
Yep.
I'm sorry. Yes.
No, it's okay. It's okay. You tell your story.
They
Yes.
start in the legs and then they move up to your lungs, and they have to travel through your heart to get to your lungs and all these things. But so fast forward to me getting pregnant at 25 with my first son. Due to that history of having PEs, the doctors went ahead and prescribed me a very low dose of 25 milligrams once a day of Lovenox, which is the blood thinner by shot.
Mm-hmm.
So I took that once a day. Now, I do want to say this. When it came to knowing that my husband and I wanted to have a child, I did my due diligence in looking for maternal care. So I was able to find a practice that I thought fit me and had really good reviews. And they had a variety of staff. And by that, I mean they had physicians, they had doulas, they had physician's assistants, and they had midwives.
Mm-hmm.
My intention was to try to give birth naturally, like out of the hospital. However, due to me having that clotting issue, and after talking to the doctors, we just felt like it was a better and safer route for me to just give birth at the hospital, which I was totally fine with because I was at that time okay with everything. So I had my first son. It went fine. I stayed on that Lovenox until I got done breastfeeding,
Mm-hmm.
breastfeeding my son. So move forward to 2020. I am 38 weeks pregnant. And I wake up in the middle of the night, February 9th, 2020, and I had really sharp pains on my right side.
Mm-hmm.
Now, this whole pregnancy had been fine. We did the same routine we did with my first son, which was the 25 milligrams of Lovenox once a day. And I went to work, I went to my appointments. Blood pressure was always fine, no
Mm-hmm.
other issues whatsoever. I walked and moved around when I could.
Yeah, and Kelly, could you tell us
Yep.
just for a time frame? I think you mentioned it earlier.
I'm
How
sorry.
old were you whenever you had your first pregnancy, and then to the next one? I just wanted to encapsulate that.
So my first son, I was 25 when I had him.
Mm-hmm.
My second son, I was 28. I was 28.
Okay.
Yep.
And did you mention with your doctors, did you do a little bit of preconception counseling or talk to some high risk doctors as well, or?
Not for my second. Not
Okay.
for my we already knew, like, okay, she's automatically at 6 weeks is gonna go on this blood thinner. Now I will say that, and it'll make sense more, but at 6 weeks is when they started me on the blood thinner because they wanted to make sure, one, I had a viable pregnancy and everything, and then we put her on this medicine and she was fine. That's the way it worked my first pregnancy. That's the way it worked for my second pregnancy, and it was fine. So fast forward to February 9th, 2020, I woke up to a very sharp pain. I had noticed that I had a headache earlier in the day, but I didn't really pay it any mind because I'm someone that actually suffers from migraines. So to me, it's normal. So I laid down, I went to sleep, and I woke up with these sharp pains. Well, I noticed that my son wasn't moving. And so I woke my husband up and I said, you know what, we have to go to the hospital. I told him, because I didn't want him to freak out, I'm having contractions, we need to go to the hospital, but the pain was not that. So we got to the hospital, they checked for a heartbeat, they couldn't find one. And they said that my, baby had passed away.
Oh, no.
They rolled me back to a room and they gave me my options, which were, you can have a C-section to get him out, or we can give you an epidural so you're not in any more pain, because the pain was still there. And they said, we can give you, epidural so you don't feel that pain, and you can deliver him vaginally.
And where were you having the pain, if you don't mind me asking? I'm sorry.
The pain, it was okay. The pain was my right side, like stomach area, like upper. It felt like that whole right side in that area was just sharp pains.
Oh no, I'm so sorry to hear that.
Yeah, it was bad. Well, come to find out, it was my placenta abrupting.
Okay.
So
and
it was
placenta abruption, just for our audience, it is a process that happens when the placenta is being separating from its attachment in the uterus. Okay.
Yeah, so that's the pain that I was feeling, and it was excruciating. So come to find out, my blood pressure had risen out of nowhere. We had been checking my blood pressure the whole time. I do have a bit of a family history with blood pressure. However, my blood pressure was always fine every time I went to the doctors. I had a cuff at home. I check it, it's fine. My dad actually was at that time on medicine for his blood pressure. So I developed pre-eclampsia, and that caused the placenta to abrupt like that. I decided to take the epidural and deliver my son vaginally. During this process, I actually coded in the hospital. I don't really remember all the details. That's something actually my husband could probably tell you more of, but I coded in the hospital. When I came to, I saw a lady standing over me with a bag of blood, and she was pushing it into my body. And I also do have, still suffer from those blood clots as well. They were able to get me resuscitated and back to normal. And that was just the extent of my stay there. I stayed for probably a week until they felt comfortable enough to let me go home. But yeah, essentially my placenta abrupted from high blood pressure with that pregnancy.
So the diagnosis of preeclampsia was also given to you, and being a triggering event. Yeah, we are definitely sorry to hear that. I'm hoping that as we ask, kind of other questions throughout, we can kind of get to some solutions and something that we can impart to some other folks. Trish, want to know, we've gotten a chance to really hear Kelly's story and just really get a chance to also hear your story about your birthing experience, your pregnancy and pre-pregnancy days, the birthing experience, and after birthing.
Okay. Kelly, first, I just want to say I'm sorry for your loss. I too suffered through preeclampsia, and it was diagnosed very late. And my first pregnancy, I'll rewind a little bit, but I was touched by Kelly's words. When I was 30, I had our first son, and, I had a very healthy, normal pregnancy, went to all my prenatal visits. There was never any indication that anything could go wrong. I had no pregnancy complications until it came to delivery. So I was, I hadn't looked into a midwife or a doula, which to this day I wish I had back then, but I wasn't that familiar. But I did want to have a normal, birthing experience, a natural, I should say, birthing experience with our son. So I was prepared with all my birthing affirmations. I did a lot of reading, to get myself prepared and just educated and ready to give birth. So I thought I knew a lot going in, and I thought I was expected, I thought I was ready for the unexpected, but I wasn't. So what happened was, I went into the hospital about a day before he was actually delivered, which was the day before he was due. And I was having like contractions, Bracken Hicks. It wasn't very, it was kind of mild, whatever, but we went anyway. And so I wouldn't dilate. I was in triage and I spent hours not dilating. So finally, they said, well, you can go home and wait it out, and see if you dilate at home, or we can help you dilate. Right. And so I was all about trying to do it naturally. So I said, I don't want to get, I didn't want to take any medicine to help me dilate. So I went home. I was fine at home. And then I got the real contractions like the next morning. And yeah, my water had broke. So we went back to the hospital. And it was like my water had been broke for about almost 18 hours. The doctor allowed me to go that long because I kept stressing. I want my body to do the work it's supposed to do. But I still wasn't dilated enough. So they were concerned about the baby's health at that point and figured I needed to have an emergency C-section to get him out. And that's what we did. During the C-section, I remember the anesthesiologist just very close to me. He kept asking me how I was doing. Was I feeling any pain? Like the procedure seemed to be taking longer than normal. So they gave the baby to Charles, and I kind of, they must have put me under after that because I didn't remember. I just remembered the doctor saying, we're going to send dad and the baby out of the room. And next thing I know, lights out. I wake up in my hospital room and my mom and Charles are there. And I was a little disoriented, and I was looking for my baby. And I'm like, where's my baby? And finally, the doctor comes in and she explains to me what happened. Well, she said that my uterus would not stop contracting and I was losing so much blood. And so they literally went and told my mom and my husband that I probably wasn't going to make it.
Oh my
I
gosh.
had signed something saying that I refused blood transfusions and I didn't want any blood given to me. So that was the urgency at that time. Um, Somehow by God's grace and the doctor's hands, she described it to me that she roped my uterus up like a ham to get it to stop bleeding. And that's what saved my life.
She
And
wrapped it up. She wrapped it up to stop you from bleeding after. And
yes,
did you? And were you not trying to take blood, or was it you didn't want to
right.
take the blood? Okay.
I didn't want to take blood. My sister
Mhm.
had gone through that and she had a difficult time. Um, yeah, so unfortunately, me and my two sisters, we all had a difficult time bringing our children into the world, and thankfully, we all made it.
Right.
But my son, who was born, at that time, like I said, I was 30 years old, so I was getting a little older. By the time I was 34, I was pregnant again, and no one considered me high risk. Nobody thought that because of my previous experience, they should keep a little closer eye on me or whatever. So this time, again, I had a perfect 9 months pregnancy until my very last prenatal visit. I presented with high blood pressure, which I had never presented before. And my doctor wasn't concerned. She sent me home without any recommendations. And what happened is I ended up in the hospital by chance, probably a week after that, because I didn't feel my baby moving. And so I go in, they hook me up. They say everything seems fine. The baby monitors were good. My heart rate was good. So the only thing, again, that was wrong that they noticed was that my blood pressure was still high. And the doctor found out that there was protein in my urine. So instead of keeping me in the hospital, they decided, well, why don't just go home and pee in a bag, and we'll see how much protein is in your urine on that next day when you come back. Right. So I did that. I went to work, you take their advice and you listen. Well, unfortunately, um, how many days later? 2 days later, I didn't feel my baby moving again. And then I excrete something that looked like green pea soup. My sister rushes me to the hospital. They take forever to get me into triage. By the time they get me back there and hook me up, there's no heartbeat. And this was a week before my Anthony was due to be born. So he literally died, because of preeclampsia. They said they diagnosed me late. My levels were 397. They had to be 400 at that time. This was about 11 years ago. And if your protein levels weren't where they were supposed to be, then the doctor didn't diagnose you with preeclampsia. And that's how it went for me. That's exactly how my doctor explained it to me. And it's devastating.
Yeah.
Because he should have lived. Like, I will never stop believing that my baby could have and would have lived had they kept me in the hospital instead of sending me home to pee in a bag. So yeah.
Well, Trish, we are definitely sorry for your loss and for the things that happened and for this expected birth for Anthony to not be here. And it's just always so heartbreaking, because like you say, you are here with this baby for 9 months, you are expecting, you are doing everything that you feel you need to do in order to care for the baby, and care for yourself too, and for, kind of the standard care is what it seems like took place. But even with the standard, we had a bad outcome, right? So even with them doing the things that are nationally, labeled as appropriate to do, we still had a loss. We still had baby Anthony, who was not able to see his life. So let's talk about that, even,
Yeah.
and we'll kind of talk about some of the, things towards the end about what are some changes that we would recommend. But I think even now, we would want to ask, the question of, after that happened, what are the things that you did in order to help cope? Was it your friends and your family that you were able to connect with?
Thank you so much for sharing that story.
Yeah.
You're welcome.
Kelly as well, but it's always, I think, difficult when you relive or go through something, and then it is such a vulnerable experience to share that, because you somewhat relive that trauma. And I understand, the your experience is your experience. You went through that experience, and I think Dr. Allen had mentioned some things. It sounds like, regardless of you doing all the right things, your doctor's doing all the right things, you developed a bad outcome. And I don't want us to lose that piece of, okay, where do we go from here? And what are some questions that maybe you could have asked, or we could have asked, or collectively as a community, what do we need to be aware of now that this experience has been had, so we can kind of be prepared for what's coming next? And I just that's such a just
And
a
kind
very
of, we're gonna start hitting those like towards the end, so we can kind
yes.
of. But before we get there, I really want us to kind of talk about, okay, so we had this happen.
Yeah.
What are the things that were helpful in your life? Friends, family, who, therapy. What are the things that you kind of use in the very immediate setting? And then, what are the things that you did even months or years later?
Yeah.
Mhm, mhm.
And Trish or Kelly, whoever
Yeah.
would like to take that first.
I immediately, I mean, honestly, I went to a deep depression when Anthony died. It was very difficult for me to
Mm.
understand what had happened. I was angry, I was angry at myself. I was angry at the doctors. I was angry at Charles. I was angry at the world. And I had to undergo counseling. I eventually sought help because I had to spend some time away from work to heal and to come to terms with my loss. And it took several years. I bought this piece of jewelry. And this is one thing I did for myself to help commemorate my baby. It's a mother and child, and it has 3 diamonds on it. So this I did just about immediately, probably within a week after I was discharged from the hospital. Later, I would have his feet print tattooed on my heart. Those are the feet print that they took the day he was stillborn. I just did that 2 years ago. That meant a lot to me. So over the years, I've planted lilies in my garden to grow and to come up every year in remembrance of Anthony. We had a 10-year commemoration celebration in my yard where my mom and my dad and my sister were on Zoom and my son was there, and these were meaningful things. I journal a lot. I write poetry, and recently, and I'm not trying to promote myself at all, but Janelle knows I recently just finished writing my book. And the title is How to Survive When Your Baby Dies. And it's a memoir and a comprehensive guide to overcoming pregnancy loss and infant death. And I'm proud of my work. I'm ready to be published, but these are the things that have helped me um, to deal with my pain over the years. So thank you for having me.
Absolutely. Absolutely. And and Kelly, would you like to share some of the things you did in the immediate setting, as well as even months to years after?
So my son died, was stillborn at the top of 2020. And I was set to have 4 months maternity leave due to my job. And so the HR manager actually went through something very similar. Her son passed away, I think, 2 days after he was born. And so she immediately was like, we didn't expect you to be here, and so we don't want you to be here. Take your time off for the next 4 months, and we'll see you when you come back to work. I'm going to be honest, I'm not someone that deals well with public grief or having people constantly like in my face about it. And so I did have a therapist at one point, but I did not go to therapy. I felt like my therapy was at that point was just being with my son and my husband. Also, we went into lockdown, right? And so I was like, lockdown was good for me. I needed that. I needed to just be able to not worry about work and finances because I was still getting paid. And then to not have to worry about people wanting to constantly come over and check on me and, all the things. They did text and call, but I could take my time getting back to those people. I could lay in bed all day if I wanted to and not have to worry about, getting up or to tend to, even Jelani, because we were all at home. So, he would do his own little thing and Zoo was home and I could just be, we got to spend time together. And so I felt like I would journal. I would just pray a lot. To this day, you can't tell me that my son is not with us. There have been things that have happened where I'm like, okay, he's definitely around here somewhere. Such a little happy spirit. To commemorate his memory every year, our thing is to bake a cake, and then we buy a toy and we donate the toy in his honor. And so I have his ashes, and I keep them near us, and I've given some to my father-in-law and my father. But my part of my healing process was just to be and sit still and think about what happened. I went through all the blaming myself. The anger, the sadness, the not understanding why what happened and all those things. But I feel like if I was to go through something so tragic, at least I was able to deal with it in my own time and how I felt like was the best way possible for myself. But in order to commemorate his memory, we talk about him. My son knows who he is. My son was actually in the hospital when he was born. So unfortunately, he was able to see all of that. He knows he has a brother. He knows that is his guardian angel. And he talks about him. So that also is healing to me because he remembers him. He remembers his brother.
I thank you guys again for sharing, that experience, and particularly what you just mentioned, Kelly. And I think that it's so very sweet and therapeutic how you and Trish commemorate the memory of your of your loved one that is no longer with us. I mean, I think that is such an important thing to do. You almost made me tear up a little bit, you guys.
Well, no longer with us in physical, but definitely with us in
But
spirit.
with us in the spirit. And it sounds like there's some aspect of spiritual healing that took place with both of you as well. I mean, is that, I know you mentioned you prayed a bit, Kelly. Is that fair to say for both of you?
For me, yeah, it is. I mean, I would just like journal and yeah, pray and talk about him to my husband. Like he was real. He's a real person, a real baby, and he was here, but he's not here anymore. So we have a guardian angel, and that's just how we talk about him, you know.
That's so beautiful. How about you, Trish?
I would agree. I mean, prayer definitely is what brought me through all of those hard times. I even how do you say, I even gave my life to God and became one of Jehovah's Witnesses when my baby died. And it brought me a peace, a comfort, and a hope, to know that one day I could see him again. And that's what strengthened me.
Yeah. Yeah.
Were there any specific books or websites that you would frequent that would also offer, just something that someone else can use as well?
Mhm.
And now, Trish, you have a new resource. So we'll have to, at the end, you'll have to say the name of the book again. And then also,
It's not published yet. I'm
okay,
working.
okay,
It's in the works.
okay, sounds
It'll
good.
be on
But
Amazon soon, and I'll have some printed copies out there. But yeah, it's in the works.
well, we'll keep once it does get published, please let us know so we can put it on
Yes.
our social
No.
media and make sure that we're able to send it out to our subscribers and followers. And that's also a good reminder. Please remember to like, subscribe, and follow us on our different social media pages. So back to the question of, were there resources at the time that you guys like to use, or books, or even podcasts or radio stations, not radio stations per se, but rather just something that you use to help
Get through everything. Mm-hmm.
I would say I was at Royal Oak Beaumont when my son passed. They gave us a folder full of resources and whatnot. They gave it to my husband, and I remember he was going through it and reading, certain things and whatnot, and like little pamphlets or websites we could go to if we wanted to look into counseling or group counseling for other parents. I just remember like researching things on the internet. I feel like my way of getting through grief was researching what had actually happened to me. So wanting to understand, my creatinine levels might have been high, or wanting to understand exactly, what the placenta, what was going on with my body, what could have caused it, symptoms to look out for again. I feel like information is power, or knowledge is power. And so you want to make sure. I was like, I knew I want to have another kid. So I felt like I kind of delved into let me do research so I can, and I was already a DONA trained birth and postpartum doula. So I already had some knowledge, but like when you actually go through something and you become more aware, I just would like look more into the situation I went through and all the things the doctors were throwing at me left and right and all the medical terminology. And so that's kind of what I did. I didn't really go to like any, grief counseling or anything like that.
Mm-hmm. Yeah. And
researching. Yeah.
yeah. So you touched on something. You touched on a lot of terms there that I wanted to make sure that our audience is aware of, Kelly, and one of them being a doula. And so for those that, could you kind of tell us in your own words what a doula is and what they do?
Yeah. So there's several kinds of doulas, but I was trained in birth and postpartum doula. A doula is a non-medical helper, as you want to say, to get your baby earthside. Doulas can do anything from coming over to help you prep for baby, like maybe doing meal plans or helping you with other children so you can go run errands that you need to take care of, like doctor's appointments. Doulas are also going to be the ones to help you actually labor. So you might want to go over some laboring techniques, things that will help you, stay calm. I know that my doula, when I had my daughter, actually went over, those things after you have the baby, like the vitamin K that goes in the eyes and other little, I think that's what it's called. Sorry if I'm wrong. Like okay, other little things that.
No, I was just gonna say, just you're right as far as basically helping deliver medications that you need, or all the things after.
just like helping you educate yourself, telling you what you should look into. And then on the postpartum end, it's okay, you've been home for 2 weeks. Let me start coming over to help you get some rest or see where I can kind of fill in those gaps. Like again, if they have multiple children, you can go help with those children. Do a little light housekeeping and cooking. So a doula is anyone that can, assist you during and after pregnancy that's non-medical.
Interesting.
But I
Okay.
want to be very clear, it's non-medical.
Yeah. Well, so that part about the doulas, like postpartum, I wasn't really aware of, like, or is that unique to different doula practices in terms of being able to do more of the postpartum, assisting with childcare support?
I think it's more so up to the doula. So some women just
Okay.
want to do work, and then some women are okay with doing the after, but then some women want to do the postpartum care because postpartum care is more it's more dependable, and it's also you can schedule it, right? So if you have a family, you're like, okay, I want to still do some doula work, but let me see what this mom has going on. Let me see my schedule. Whereas like a birth postpartum or a birth doula, I'm sorry, is someone that's like on call. Okay, when is she going to the hospital so I can go help her labor and whatnot? So
Okay. All right.
Mhm.
Yeah. Thanks for sharing that. And I think that's important to kind of know, just so that our audience has a range. So what I'm hearing you saying is that you may need to seek out those resources and determine what exactly services they offer, correct?
Yeah. See what you need and then go based off your needs.
Okay.
And then did I hear you also say that you had a midwife as well?
I did not have it. Well, we had a midwife at my OBGYN, the practice that I went to. So I actually was she was in my rotation of who I seen, and I did keep in touch with her, but I didn't have a midwife. I did have a doula.
Okay, got it. All right. So you guys had different experiences, completely different places, and essentially, you guys were also able to cope in different ways, in some similar ways, but in some different. So, I guess the question that I have for you is, what are some of the biggest ways that you felt like maybe you were able to like lessons that you really want to share with other women as well as fathers, but basically lessons that you feel like, here's what I learned and here's what I really hope others can walk away from.
I would love to reiterate what Kelly already mentioned in terms of doing your research. I mean, I think that is absolutely vital to any woman who is planning a pregnancy, planning a family, planning a subsequent pregnancy, experienced loss, had a great outcome first time, whatever your situation, if you are in the business of making babies, and this is for men and for women, you have to do your research because there are so many risks out there, especially for Black women that we're unaware of. Preeclampsia is something that I knew about, but I never thought it would have affected me. I didn't know everything I needed to know about it. And I certainly kicked myself in the rear for not asking enough questions of my doctor. So that's the second level or lesson that I would like to share is to ask those important questions. You might want to find out what's your doctor's personal experience with pregnancy loss, or labor and delivery complications, or just Black maternal and infant deaths. What have they experienced in that regard? I remember asking my doctor after Anthony was stillborn, how many patients had she had that experienced something similar to me, and she told me 10. So she had 10 stillborn babies throughout her career, and so my follow up then was, well, why didn't you do something different? What could have been different between each of those situations, or how did each woman's circumstances differ, which would have made you then turn and individualize her care, and so it's just so important to never stop educating yourself. Just learn as much as you can and have the tough conversation with your healthcare providers. Get a doula. I think doulas are fabulous. I wish that was something I knew about 15 years ago when I was having my kids, because I don't think it was that common back then. And yeah, I think that those are my takeaways really. education, education, education.
So,
Right.
and I think, yeah. And how about you, Kelly?
I personally, obviously would want, a woman to educate herself, but not only that, to educate her partner, making sure that when she is, you know, maybe under or going through something where she's not clearly thinking it through, that her partner is able to advocate and that her partner is paying attention to what is going on. So you want to make sure that, one, we're having children with responsible adults, right? And then two, that we're having, like Trish said, those tough conversations. I also always tell moms, like, I've been to the OB and they have been like, okay, you're pregnant, eat what you want. And you want to make sure you're enjoying your pregnancy cravings. But we know that blood pressure is linked to maybe not eating the best things. And so while your doctors are encouraging you to eat whatever you want because you are pregnant, let's also make sure that we're having a balanced diet. It's okay to indulge, but don't overdo it.
Mhm.
And I feel like diet is so very important. I've learned that over the years, even with dealing with, my blood clotting issues, how important it is. The next thing I would say is that listen to your body. No one knows your body like you. You have instincts and
Yeah.
you actually have to advocate and fight for yourself, right? So me, like I had a headache, for example, where I used to have migraines. I was used to it. However, what I noticed afterwards was, I don't know if this is by the grace of God or what, but during my pregnancies, I actually never had headaches. And so for me to get a headache out of nowhere at the end of my pregnancy, I probably should have been more mindful, like, okay, wait a minute, you're having a headache. This didn't happen your first pregnancy. It didn't happen most of this. This is linked to that. Or it could
Mhm.
be. That is a sign that your blood pressure is up, that you can get a headache. So I would just say be very mindful and aware of your body, communicate with your partner, educate yourself. And I think having a balanced diet is really important as well.
And Kelly, that was such an important piece that you just said there. That is so, so very important. That is very astute of you, because that is actually one of the warning signs that we talk about. And it's, having a headache, having some pain on this side,
Mhm.
there's what we call pain on the right upper quadrant pain. You know, you did all the right things, but and you kind of sense, and even I commend you, because you were like, oh, I have migraine headaches, but now I'm having a little bit of a headache, let me go to the doctor. So many times, some of us ignore those, even from, I'm not trying to put the lens on men, but we ignore those signs of things that might be amiss, and we don't go in. But you did the right things. Unfortunately, it resulted in a bad outcome, but having that presence of mind, I think, is so important. Being like, okay, I'm having a headache, I'm having these warning signs, and
Mhm.
those are some things that we really, really want to impart to our listeners about those warning signs. And definitely asking your doctors, okay, what are the warning signs of these things that I need to worry about?
Yeah,
Yeah.
sorry, go ahead. I was just going to say, I
Yeah.
think that's like a perfect education question, as we were talking about. So, I mean, and I also think, like, there's a couple different things, because one of the things is we understand that health equity is the responsibility of so many different layers. And right now, you guys are doing the beautiful thing of saying, okay, well, here are some things that I could have done differently. But then we also know, you're also mentioning that there are some things that your doctor may have could have done differently. But we also know structurally,
Mhm.
there are issues that are around the birthing process. Because, like we said, we kind of went through the standard of care. You guys went through
Right.
all your visits, but yet and still there was this outcome
Is this
that was
thing.
not the intended outcome, right? So
Right.
one of the things for health equity is the idea that, one, how do structural, what we call um, social determinants of health,
Mhm.
change the dynamics for individual healthcare, right? If we know that Black women are having, as we talked about, higher incidences of complications, how do we, in one, the government, as far as policy is concerned, make sure that additional visits are paid for and reimbursed, specifically for Black women and other women who are at higher risk. So there are things that are underway, policies and laws that are coming under progress or in process, so that we can make sure that health policy and health reimbursement is happening. Number two, if indeed Black women and women of color, because like we said, even Hispanic women have represented 20% of the maternal deaths in 2021, how do we make sure that we decrease any barriers in between the patient and provider conversation? And what we've learned in other studies is that we decrease some of those barriers by making sure that people in the room look like the patients who we're serving. Because sometimes, and not to say everybody can care for anyone, but sometimes there's a certain level of mistrust that already kind of exists. And when you have more providers that look like you, sometimes some of those barriers are decreased, and you communicate more. You might say like, now listen, I know you want to eat certain potato chips that are we all grew up with in different cultures. They might be you might be able to take it better, where you feel like, okay, this person isn't judging me because of the color of my skin or because what they think about all my people as a whole, but rather they're just kind of trying to tell me to do in a way that maybe my sister or cousin would tell me. And then also, so we got increasing representation in healthcare, from doctors to nurses to midwives to doulas. So increasing that training supply. So that's one of them. And then, the other idea is making sure, again, that we have special insurance coverage and special funding that goes to community organizations that work in areas with predominantly Black and Brown women who are giving birth, particularly women who are younger, as well as women who are older in age, because we know that as we get to our 30s and as we get to our 40s, then the risk and complications increase, just because of natural things that the body wants to do that we don't want it to, right?
Absolutely.
So the question that I feel like is really important to ask is, one, do you feel like your race played any part of some of the barriers or some of the outcome, the unintended outcome? And then on the backhand is, after this whole situation, have you had any additional mistrust to the medical community? And either of you guys can.
I can answer this first. So due to my son passing away, and then when I got to the hospital, he had already passed away. The focus was really on making sure that I was okay and stable. I felt like at that point, the medical staff made sure to not only try to inform me as much as possible, but they made sure to inform my husband, and he made very clear about what was to happen in case of anything. And it was, my wife needs to be here. Like, we need her here. So you do what you need to do. I will say this, my trust for the medical system now has gone down, not necessarily because of that pregnancy, but because of my pregnancy with my daughter, who is now 1. I ended up having a DVT from my stomach down to my right ankle when I was, I think, 4 weeks pregnant with her. I was sent home, told it was just a cramp in my leg.
Yeah.
I ended up going to the hospital where my doctor was actually located, getting admitted. And I was told by surgeons who did not look like me, who could not bear children, that I need to abort my daughter after I just went through losing my son. I felt like my concerns weren't being heard. I felt like I wasn't getting straight answers. And it was women that looked like me and my OB who were advocating for me. And it got so bad that I had to get transferred to another hospital. I'm pretty sure there were write-ups that happened and whatnot, but that situation made me, one, realize that I will be going back if I was to have another child, back to the hospital I was at. And then two, that you really, really, really have to advocate for yourself. You do not let anybody give you half answers. You do not let anybody brush off your concerns. If you want to have them run a test because your history, your body, make them run a test. Not only did I have a DVT, but I also had PEs because I was having trouble breathing and that was going to be overlooked. I had multiple surgeries while I was in that hospital stay, and I was in the hospital for a month.
Mm-hmm.
So I will say I've had two instances where it's been scary,
Mm-hmm.
And I'm glad I listened to my instincts and just my daughter she's here, she's fine. But that experience is not something I would wish on anyone. So
Right. So I just wanted to ask you, go ahead. I'm sorry.
I was just gonna say, I think the medical community, as far as some of the maybe older generation that doesn't look like us, they need retraining, they need restructuring of how they do things. And I'm just very glad that I had brown skinned women there saying, no, this doesn't feel good. She's not comfortable. She's not happy. We need to figure something out. And the figuring out was transferring me out of that hospital.
But Trish, the same question to you. Did you ever feel like at a point that maybe your race was playing a part in some of the barriers of communication or education? And on the flip side, do you feel like because of your experience, you had any increase in medical mistrust or development of medical mistrust?
I would say yes. I think mostly about my experience when I went into the hospital that week after I presented with high blood pressure, being pregnant with Anthony. And the doctor in the triage was an older Caucasian man. And I remember him asking me, do you know what preeclampsia is? And I told him yes. And he literally said nothing more. He exited the room, didn't attempt to explain how it was playing a role in my personal circumstance.
Exactly.
Didn't attempt to explain that me nor my baby could be in danger. And me being an educated Black woman, and I should have asked more questions. I should have asked more questions. I honestly should have. And I was preoccupied at the time with going back to my teaching career because I was getting all these lesson plans ready for the new teacher that was going to take over for me while I went on my leave. And I remember a friend of mine who, having her first child, she actually experienced preeclampsia. And she had, all type of organ failure. She was in a hospital for months. Her baby was super premature, but she lived. They both lived. And it was pretty much a miracle. But I thought that, coupled with the research that I had done on my own and the fact that I was feeling well and the monitor said I was fine and the baby monitor said he was fine, I think all of those things together made me not question the doctor. But being the professional that he was, he should have explained to me, but instead he came back to the room with a bag and told me to go home and pee in the bag for 24 hours and then bring it back to the hospital. And my doctor would follow up with me. So
did you understand? Did you know what that meant or what that was, the test or anything?
I understood that it was to collect my proteins or my urine to measure the protein levels, and that the higher the protein levels, the closer I was to preeclampsia. I did understand that. But what I didn't ask, and I again don't understand why, I didn't ask what are my levels until I was in the hospital with my stillborn.
So go ahead.
I trusted my doctors. And here's where things get funny. So my actual OBGYN was in the hospital that day. And she was the same one who did all my prenatal visits because I chose to see the same doctor thinking I would get better care. She, whatever. And she never came down to see me. Now I understand y'all get busy. She probably had other patients, did that, whatever. Fine. But I felt as if because my blood pressure was high, my last prenatal, and it was high a week later, and now I've got protein swirling around, they should have. I just don't understand why those weren't red flags. I felt more like when my doctor's office called me the third day and said, "Oh, you need to go on bed rest. Your protein levels are high." They still never said anything about me actually having preeclampsia. They never said that until I was in the hospital and he was stillborn. But I think where my race played a role is that, and I hate to say it, but I feel as if they wanted to use me as a guinea pig, especially after my doctor told me that she had already experienced 10 stillbirths. So why would it, when they called up to you from the triage, why wouldn't you think, oh, this is a Black woman, I should err on the side of caution because she's already at greater risk just because of her race? Not that she's had a lot of health complications. You know that I'm going to read this statistic to y'all because it blows my mind. But
Mhm.
according to the Black Maternal Health Caucus, an educated Black woman living in the United States is more likely to die giving birth than a white woman without a college degree.
Yeah, that's
So
what I was mentioning
Yeah,
earlier.
that
Yes.
is correct.
Mhm.
yeah, so
Mhm.
doctors have to tell us, hey, look, you're at risk just because you're Black or brown. And it starts there. And then take a look at my individual health record and say,
Yes.
okay, what further complications might come up? What other precautions should I take for this patient so she can have a good outcome? And I didn't
Y-
think those things were done for me.
Yeah,
This
so
is
I
such a
think
perfect,
yeah, and I
Jenny,
think
hold
this
on.
is
Let me just
great.
say this. This is such a perfect thing of what we're talking about for health
Right.
equity. Because so often, many people feel like, oh, it's racist to treat people different. And that is not
Mm,
the definition of racism. Racism is when you are treating a whole group of people negatively
mhm,
different and negatively impacting. When you, it in
yes.
equity, we talk about the fact that you can't treat everybody the exact same way. You have to treat people according to their needs, right? You have to be able to recognize that some groups are at higher risk, and that because of that, we have to have legislation that supports us when we are doing more for a patient who's at higher risk. For instance, you, again, we talked about this, the fact that you got received standard of care, but in your case, you needed more than the standard of care. You needed the idea of understanding, wow, this person is borderline. And yeah, maybe they're 3 points away from the actual number, but I'm going to fight for my patient to have more care and to be observed and monitored because guess what? I don't want a negative outcome in her. And if that means I'm going to fight insurance or hospital administration, then I will. Because one thing about medicine is we do allow for exceptions and we do allow for the physician to have their own assessment of the situation because guess what, medicine is partly art and science, and so sometimes we have to understand when, what, there's a certain feeling I have about this patient, we're too much on the brink, and I need to fight for my patient, and also sometimes having those other advocates. All right, I'm gonna stop there. I just want to know, like, what you said was such a perfect example of why equity involves sometimes doing extra steps in order to meet people at their need. We can't just do the same blanket thing for everybody. It is about additional steps.
And to what Dr. Lee Allen has mentioned is understanding, and that's the paradigm shift that we're undergoing now. And it's not that this is a new thing, right? We've been aware of there being disparities. We talk about disparities in health, disparity in this, but I think COVID-19 kind of pulled back that veil once we really saw what was happening in different areas that we had more Black and brown people, and kind of just shone a light on it. But to her point, I think there's some aspect of really understanding, okay, I have a Black and brown person that they may be at high risk for this. I need to be kind of like have the red light on and kind of thinking about that. And so that paradigm shift is occurring, and that's part of that whole aspect of of changing the landscape of health as it comes to our Black and brown women and their health. In terms of taking care of them and treating the individual, kind of like what you were speaking to. I did want to ask one last thing, because I think that's really important. What in your process of your pregnancy or pre-pregnancy process at any point, did anybody tell you that you were high risk? And if they did, how did that impact your health plan, or was there any kind of thing that you did differently after hearing that, if that did occur?
For me, it didn't.
Okay.
I was told I was high risk my first pregnancy, and it was due to the clotting. That movement, but I didn't feel high risk, if that makes sense, because everything else was fine. So moving forward, they always kind of treated me like, okay, she's high risk. We have to watch her clotting and whatnot. Hello. We have to watch her clotting and whatnot.
Yeah.
But
Hey, little one.
yeah.
Yeah.
So yeah, but
So you
and
did.
definitely
High risk, and I was kind of treated that way.
And did
I
you
would
have a high risk doctor or maternal fetal medicine doctor?
I didn't doctor until I had her, and they sent me to U of M.
Okay. All right.
So I think, closing out, again, being mindful of the time, closing out, because I know the babies are like, I want my mommy back. What's happening? What's happening? I can't hug. And then the fur babies are like, come on, I need attention here. So nonetheless, in closing everything out, I feel like we've had a very rich discussion. We thank you so much for sharing your experience, for being able to share also the hopes that you have for the future, for what, you feel like really could have been different and you want to have different for the next group and generations of moms, Black and brown. And I really want to say, all together, we still have hope in the medical community. We still have hope in the policy creators to understand this. And we do this all in order to help facilitate the elimination of health inequity, to promote health equity, to talk about the fact that there are real people on the end of health inequities. There are real people on the end of health disparities. And we get out these stories so that they can know this too is happening, and we want to make sure it doesn't happen again. That is the goal of medicine. That is the goal of Young Black Physicians, and that is the goal of all of our programs, facilitating the end to health inequity. So
and I did want to give you one other resource, because I think this is very important, that what Trish and Kelly mentioned. Make sure you take the time to talk to your doctor for all our Black and brown women, as you're planning on getting pregnant. Make sure you do what's called preconception counseling. This is a time to kind of talk about, as you're thinking about having that pregnancy, to see, okay, what are my risks? Ask those important questions, because it gives you that time before the starting point. Secondly, I would also say, I wanted to point you to a resource. It's called the CDC.gov. It has a resource called Hear Her Concerns. And it has a lot of the warning signs that Kelly and Trish mentioned about, particularly what Kelly mentioned about having severe headaches, dizziness, fainting, that pain, chest pain, difficulty breathing, things that you guys can share, those that are listening, as well as all of us that are participating in this call, we can share with others, because we do want to educate and be that beacon in terms of elevating someone else's experience. So those are the last things I wanted to say. And they've got a great cutout and a great primer to kind of be able to share, because the other part of this piece is community-based, and communities, even our own community here of individuals we talk to, are a large part of the driving force that moves a lot of these health legislation